Well, it is National Prostate Health Month, also known as National Prostate Cancer Awareness Month. It's observed every September, and it's something all guys could stand to know a little bit more about. I'm so happy to have right now Dr. Stan Honig. He's the director of the Men's Health Program at the Yale Cancer Center with me right now. Thank you so much for joining me today, Doctor. Glad to have you with us. It's certainly, I think, something a lot of men have to be aware of, especially as they're getting up later in years because it's so highly correlated with age. But why don't we start with what you feel men need to be on the lookout for just to have their radar up?
So generally speaking, Tim, men, unlike women, don't go to the doctor regularly. Women are kind of trained to go to the gynecologist with their parents. Men don't do that, and once they turn 18, they kind of stop going to the doctor. So between 18 and 40, it's real important for men to kind of bind themselves with a primary care doctor. Yeah. And the prostate is something that is a silent organ for the most part. It can give you urinary symptoms, but that's not necessarily a sign of prostate cancer. So screening is something that is an important thing that you need to discuss with your doctor. The American Urological Association recommends screening between the ages of 55 and 70. Now, I think generally most people, speaking.
And when they hear screening, they're thinking of what's called the PSA test. Yes.
Right, and that in combination with the physical exam is the mainstay for screening. And it's also recommended that if you are African American or if you have a family history with a first-degree relative, so that means brother or father.